The gentleman from Texas, Mr. Cloud, is now recognized.
Thank you. We keep saying we're having a national discussion on health care, and the truth is over the last few years we haven't really had a national discussion on health care. Too often health care and health insurance gets conflated as if they're the same thing. Indeed, the chair in her open remarks claimed that Obamacare expanded health care to 30 million people. That's not exactly true. You could maybe make the case that it expanded health insurance coverage to 30 million people, but anytime you mandate something by law and say you're going to fine them if they don't have it, there's a probably good chance you're going to see an uptick in the usage of whatever that product is. But that doesn't mean that it was better. We saw some people who were over-insured, who didn't need that much insurance. For most Americans, we saw over a steady decline in what health insurance covers. Meanwhile, premiums have gone up. Too many times, families would even not be able to afford the health care because they are paying for mandated health insurance. And so it's important for us to remember that health insurance is a middleman in the process, and health insurance a middleman never decreases a cost, it always increases it. Now, in isolated incidences, it certainly should save money and everybody should have some sort of health insurance. But when we're looking at systemic ways to save money, we probably need to go a different approach than what we've been doing. And what happens too often here in Congress is we first pass a program that breaks a system, and then we come up behind it and try to be the solution to what we already broke. We definitely need a discussion, but the discussion should center on how we provide actual care, how do we open access to care, as opposed to mandating insurance for everybody. Ms. Turner, I'd like to ask you, why are healthcare costs increasing in the United States?
Goodness gracious,
sure there's a few of them, but if
a lot
you
of
could
reasons
touch
for that.
on.
A lot of it has to do with the lack of transparency. Nobody has any idea how much somebody else is spending on their care, and
Right.
Americans, they want to know those questions. But just to take the ACA as an example, the recent increase in subsidies through the American Rescue Plan put $17,000, every newly insured person in the American Rescue Plan costs about $17,000 in taxpayer dollars. But many of those people are dropping private coverage because the subsidies are more attractive to go on the public plan. So I think that we need to look at what are the incentives in the system. Are there incentives for people to get better care, better coverage, more affordable care, get higher quality? But we don't do that. We run it through rules and regulations, through federal and state and local spending programs, rather than really trying to engage the same forces that work in the rest of the economy to give people more choices of more affordable products and services.
It's interesting, you mentioned, we've talked about regulation in this committee hearing being a major driver of healthcare costs, but it's interesting you mentioned price transparency in the sense that for elective procedures, for example, we see technology being a driver, and when costs are transparent and people are able to price compare, we actually see those procedures in a market actually decreasing over time, where we see, by and large, most of the industry increasing over time. Because, as you said, what makes capitalism work is the fact that you can shop. And so we've removed that ability, that accountability metrics from the system. And so I would agree that anything we could do to put accountability back in the system would help. We talked about some of the ways that healthcare costs are increasing. What are some of the ways, maybe some technological breakthroughs, different ways that prices could be lowered in healthcare, that we could lower the cost and thus provide access to more people?
I reported my testimony about several states that have used a provision in the Affordable Care Act called Section 1332 to be able to repurpose some of the money that's going through the ACA, to be able to figure out how can we do a better job of taking care of the most expensive patients who need the most care, but they're not able to see the physicians they need because of everybody is a one-size-fits-all plan. They make this a much more focused plan, doing a better job of taking care of the vulnerable. What that's done is reduce prices across the board for everybody else, and that brings more people into the market, just as one example.
One other thing I'd like to ask your opinion on the short time I have left is, what nation produces the most medical innovations?
That would be the United States of America.
So we definitely have some issues we have to fix, but if we were to adopt the same system that does not lead to innovations, the world at large would really suffer.
The world relies on us for innovation, for medical innovations.
Okay, thank you. I yield back.